Hello everyone, welcome to my channel. Me, Dr. Somshikar Reddy KS. I'm here to share a few inputs on diabetes mellitus. First, we should know the concept of diabetes or diabetes mellitus. What the concept means? It is to understand something which serves as a building blocks for thinking, adapting, and communicate. If you look at education, we study mainly for gaining the knowledge. It's not marks. Similar to that, we should know our energy is maintained in our body with the help of insulin and other hormones, and how we develop, how to manage. It's the lifestyles are the prime, then comes the medications. Before talking diabetes, we should know what is endocrinology, what is exocrinology, what is hormone, what is the role of pancreas, how the energy is maintained, then types of diabetes, how to diagnose, then comes the management. We all know our body contains so many organs: heart, brain, liver. In addition to this, in our body we have glands. Mainly we classify endocrine glands and exocrine glands. If you look at exocrine glands like salivary glands, pancreas, sweat glands, they secrete or the secretions from the glands which are released into the outside the blood. That's why they are all called exocrine glands and they are involved in many functions. That is not my concern. My concern is, or my topic is today to speak on endocrinology. These are all the glands, the endocrine glands. They produce a substances called hormones. They're all specialized glands. These hormones directly released into the blood. That's why they are all called endocrine glands. They produce hormones. The hormones are nothing but modification of amino acids, proteins, or steroids, and they're released into the blood directly and involved in so many functions. We have so many glands like pituitary gland, which is situated within the skull connected to the brain, then thyroid in front of the neck. In the covering of thyroid, we have parathyroid gland, adrenals above the kidney, pancreas behind the stomach, in women, ovaries, men, testes. These are all the main endocrine glands. They produce hormones. They put together produces more than 50 hormones. 1 to 10 hormones will work for some purpose. The group of hormones works for some purpose. They are involved in energy, blood pressure, bone strength, reproduction, urine concentration, like that n number of functions. With that, one gland can produce few hormones or many hormones, and the hormones from the different endocrine glands comes together work for some purpose. Diabetes is comes under energy. So what is energy? Because I take 3 meals, my body requires continuous energy. First I have to store the energy and release the energy and use the energy. Like what we do in managing vehicles, the petrol, we'll store, release, and it will be utilized by the engine for moving the vehicle. So coming to the basics of energy. Energy means what? Nothing but indirectly we will speaking on glucose. Our food contains so many substances. The mainly we call there are carbohydrate, protein, fat. Once we take, the digestion will start or starts in the mouth and later into stomach, then intestine with the help of pancreatic juice. Pancreatic juice, it's mainly exocrine gland. It produces juice which is rich in the enzymes which digest, make bigger particles into the smaller particles. Carbohydrate, say starch will become glucose. Protein will become amino acids. Fat will become fatty acids. So it will make bigger into the smaller particles and once it will be absorbed. Once it absorbed, then endocrine system or the hormones which are involved in energy departments. They say, for example, the hormones which works for this energy is called glucoregulatory system. Means pancreas produces 2% of the pancreas, 2% of the pancreas will have cells, they're all called endocrine cells, alpha cell and beta cell. Alpha cell will produce glucagon, beta cell will produce the insulin. So these two hormones and other hormones mainly from the adrenals. Whether it is a cortisol, adrenaline, or in addition to other hormones, come together, work for energy, and they regulate glucose metabolism. That's why they are all called glucoregulatory hormones. So what it does is, once we take the meal, and after that it will get digested and absorbed into the blood, then insulin will come from the pancreas, helps to store the glucose. It will make again smaller particles into the bigger particle, that is glycogen, and stored in the liver and muscle. Once if we take more food in the form of carbohydrate also, it can convert to the fat and get deposited in liver and adipose tissues in the form of fat. That's why insulin is called storing hormone. Then once food is stored, because I take 3 meals, my body requires continuous energy. That's why first I will be storing with the help of insulin. Then I will keep releasing the glucose with the help of the hormones which works against insulin. That is called counter-regulatory hormones, mainly glucagon. But it has to be supported by cortisol, that is steroid, and adrenaline, noradrenaline, some growth hormone. So helps to release the food. That is glucose. Once glucose is out, again insulin pushes inside the cell because our body is full of cells. Once glucose has gone inside, after combining with oxygen, energy will be produced with the generation of energy, heat. That energy generation doesn't happen without thyroid hormones, that is T3, T4. That's why pancreas, which produces insulin, and other glands like adrenaline and a few more glands which produces releasing hormones, that is called counter-regulatory hormones, which releases the energy. And again with the help of insulin, glucose pushes inside the cells, then thyroid hormones will take into the action for energy generation. That's why these are all hormones works for energy purpose. So one more thing we should know, once insulin is released, it will be degraded within 1 hour with the half-life of 10 minutes. It will be degraded in liver and kidney. That's why insulin production is a continuous process. I want to say that with the meal we require more insulin. It releases like peaks. 50% of the insulin will be released during the meal to store the food, and 50% of the insulin constant release will be there to hold the food, that is glucose. That's why 50% will be released during the meal and another 50% throughout the night or in between the meals. That's why insulin is very important to store and to hold the food. These releasing hormones are all called stress hormones. Why they are all called stress, or in common words tension hormones? Our energy requirement in different situations. I'm sleeping, I require less energy just for breathing, heart function, brain action, like that. As I'm awake, I may require slightly, but in situations where I'm stressed, I want to fight, or the one animal has to fight to escape from other animal. So I require, or animal requires more energy. So my brain has to get stimulated. Once brain is stimulated, it helps to release more releasing hormones. Once more releasing hormones are released, it will suppress insulin action to release more glucose. Once more glucose is released, we will have more energy to take care ourselves, or one animal from other animal to take care, to run away, deer to run away from the tiger, like that. That's why the releasing hormones or counter-regulatory hormones are all called stress hormones, in common words, tension hormones. That's why tension is the basic requirement, or stress is the basic requirement for humans or animal to survive. That's why they are all called stress hormones. This is the normal phenomenon in all the individuals. There is a coordination between the insulin and counter-regulatory hormones. That's why our body knows when I require more insulin, when I require more counter-regulatory hormones. It is like in a family, earlier we used to understand what is the role of parents, what is the role of children. That's why there was a coordination like that in our body also. In normal situations, there is a coordination between all insulin and other hormones. That's why our sugars will be normal. Coming to the diabetes. Diabetes mellitus. One more is there diabetes insipidus, that is excessive urination because of some hormone deficiency. They will keep on passing more urine. That is a different this thing. That is diabetes insipidus. But the burning issue nowadays is the diabetes mellitus. In that we classify there are two types mainly. There are different type of diabetes, but type 1. Type 1 5%, 5 to 10%. Type 2 more than 85%. Type 1 usually it comes in children because of different concept, different etiology, different cause. It is not lifestyle disease. That is called autoimmune cause. What is that autoimmunity? We know our blood contains white blood cells to protect our body against bacteria viruses, not to harm our own organs. So, white blood cells are made to protect us, not to harm us. If any organ, say pancreatic beta cells or thyroid cells, thyroid or some other organ cells are modified because of some genetic potential with the interaction of some environmental factors, the structure will keep change. Then for white blood cell, it appears like a foreigner. Then by attacking, it can destroy or stimulate. By destroying, they develop deficiency problems. By attacking white blood cells, beta cells, it destroys all the beta cells which produces insulin. So once beta cells or insulin producing cells are got destroyed, they develop type 1 diabetes because of attacking by our own white blood cells because of change in the some issues. So once white blood cell attacks the beta cells, they develop all the beta cells will be wiped out and there will not be any insulin. Then they develop type 1 diabetes. I already told you insulin is the hormone which stores the energy, that is mainly glucose, but also important role in storing fat and protein. So there is no insulin in the type 1 diabetes. What happens? So sugar will not be stored. Whatever the stored glucose, it will be released or flooded into the blood. So sugars will be very high in hundreds, even 500, 600, very high sugars. So once sugar is very high, it will come to the urine. It takes the water also in addition to the glucose. So that's why excessive urination, or once water is out, then we will feel very thirsty. And water, everything, weight loss. Excessive thirstiness, excessive urination, weight loss. It will come over a period of hours to days. In addition to this glucose metabolism, it also affects protein and fat metabolism. Means protein will broken down. It will then it will be converted to glucose. That is a different issue. Then fat will be dissolved and it will become fatty acids or ketone bodies. So because they are all acidic substances, our pH will come down. So that's why they are all called diabetic ketoacidosis. So type 1 diabetes are more prone for acute or immediate problem. This DKA, diabetic ketoacidosis, it is a very serious issue in type 1 diabetes. In addition, they will have other problems also, and it usually comes in children. It is still we can get type 1 in elderly, but type 1 is common in children. And because of total or near total deficiency of insulin, they require lifelong insulin. Drugs will not be effective in type 1 diabetes because there is no insulin. Drugs will work if there is insulin inside, otherwise it doesn't work. That's why if you give properly treatment including insulin with the good counseling, they survive for very long and they will have very good life. But the problem is type 2 diabetes. Type 2 diabetes, it looks very simple, very complicated. Means we neglect because of the presentation. It is a slow poison like. Type 1, aggressive behavior. So even if you miss one day insulin, they will land up in acute problems. That's why we will rush to the hospital. But type 2, it not like that. It is a slow poison like. That's why we should, and it is increasing too much because earlier we used to have 5 to 10%. It has become 20%. And earlier we used to think type 2 diabetes is a disease of urban population, rich population, but not anymore. We are getting in rural background also it's a very high sugars, and even you are getting a very young age. Earlier we used to get after 50, 60, 70 years. Now we are getting at the age of 20 plus minus also. Type 2 diabetes. I am not talking about type 1, type 2. And it is not disease of sugars, it is a disease of multiple metabolic related issues. So we, for this we should know how we develop diabetes. We always talk, whenever we talk about the diabetes, it is a disease of lifestyles. It's the disease of urbanization. It is a disease of westernization. Like that, we have given so many reasons for that. So, what is this type 2? How weight is related? Wait, one of the most reason for getting diabetes, type 2 diabetes is obesity, that is overweight, then physical inactivity, and we are neglecting the stress. These are the main. So, when we talk about weight, many things will come. Junk food, fast food, then high calorie diet, all those everybody knows. So, we all know why we develop. There is no doubt. Our metabolism also matters a lot. That is called the persons with low BMR or high BMR. Means the one person may require two chapatis, other person may require one chapati, like that. That if the, depending on the metabolism. If the metabolism is slow, they don't need to take more of this thing. Their metabolism low metabolism, BMR, basal metabolic rate. In addition to this, overweight. One is why anybody is overweight. There is, earlier we used to be physically active, now we are not physically active, we are mentally active. Earlier our body was active below the neck, now above the neck, that is mental active. So physical inactivity. And coming to the food, we are taking the food which contain high calories, even carbohydrate also. In simple words, not the fatty food. The fatty food means the rich in all, because ghee, oil, anything. We like food which is rich in oil because they are very tasty. Then second thing is irregularity. We should be regular in timings. Timing means breakfast, lunch, dinner, specified time we consume less. But if you'll delay, you'll end up in taking more food intake. Say I take 9 o'clock 2 chapatis, 10 o'clock 3. If I skip breakfast, I may end up in taking more lunch also. One more thing, irregularity, how it matters. If you take regularly, you will not be tired. If you are not taken breakfast, after taking lunch, you will be too tired, you will sleepy, and you will become physically inactive. Your activity will come down. Or sometimes they do intermittent fasting, or if they do something called festivals and all, they don't take anything. They end up taking more meal. That's why anybody who do more fasting, they are all more overweight because of many reasons. They think that I have skipped, that's why I'll be underweight, or I can be less weight. No, not that way. That's why irregularity, high calorie diet, and physical inactivity is the main cause for that. More important, diabetes we develop in overweight or weight is normal also. Say, for example, how stress is important. Stress is not living. Stress is given to us for protection because we are in a running race. We are always running. So stress means everywhere is a stress. Whether you are in a private job or government job, or you are in a what is public sector or a private sector, anywhere, even studies, children, everything you take, everywhere is stressed. You are working under targets. See, earlier I used to love mainly two jobs. One is teaching job, other one is a bank. Teaching means it was a pleasure. Even bank, you used to work till 12 o'clock. After that, 2 o'clock, all transactions over. Bank used to be closed after 2 o'clock. Now, even teaching job also pressure, even pressure. Then this bank also, everywhere pressure. So earlier, whatever the job you used to enjoy, it has become a more stressed. And the job environment is important because people are working for many hours always working under targets. Any IT professionals always targets. Even any police personnel, traffic, on earlier used to work for that purpose only. Now we are working for the targets. You know, it is a world of targets era. So anywhere, so either you are taking more stress, or the environment around us is giving stress. The working, say, you are in a working place, so you will be given so much work. Neither your subordinates are not they're listening, or your superior is not leaving you. That's why always you are under stressed. You name anything, you are stressed. Coming to the mobile was used for the communication. It's a very good instrument. Earlier I used to enjoy mobile means used to enjoy. That system itself was, so it was used for only communication. Now the more advances, I don't have to tell you, so many apps, so many things. Always we'll be seeing hot news. Our mind will be disturbed. That's why, or else then everywhere mobile is given, whether you are a private or government job, and you are connected throughout the night also. So you will be getting continuous calls, so you will not get very good sleep. Where are you free from stress? Coming to the TV is very good, there is no doubt. So we will come to know so much things what is happening around us. But it is not only that. So there are a lot of breaking newses, crime newses, untoward incidences. Keep seeing. My mind is getting disturbed. So same thing will come in the night also. Bad dreams. Always stressed either because of this media, either it is a mobile. Even though it has got very good role in the present scenario, we are exposed to more stress. Even why we are getting very engaged, you all know. Child is obese or overweight from the beginning only. Other one is child. Earlier, the only entertainment for the parents or grandparents were child. It was a pleasure having a child in the house. Now, pressure because they'll be creating noise, all those things. Parents are they don't want, they want to see the TVs, all those things. They'll give one mobile in front of the child. Without a mobile, child will not leave us. Or sure, they'll open up the computer, they'll be enjoying. They're enjoying mentally, not physically, not anymore physically active. So their weight in keep on increasing because of the thing what we made. We are giving high calorie diet for the child. We are taking child to always restaurant. We have forgotten to cook also at home, especially Saturday Sunday like that. Or children, they're not going to play in the ground. They're busy sitting at home enjoying computers, mobile, all the medias. So their mind is working more than the body. Any overweight or overstressed people can present either type 2 diabetes or hypertension. Both are straight away heart problem. It's not the type 2 what we are educating, what we should educate is different. It's not the sugar or high sugars are the cause for heart problem. Stress is manifesting as either sugar, BP, or both, or straight away heart problem. Stress or overweight. That's why type 2 diabetes is not anymore, or what we are thinking is wrong. It is not the disease of sugars, high sugars. It is the disease of multiple problems or derangement in the metabolism. Sugar metabolism, high sugar, cholesterol related, either high cholesterol or differences in the cholesterol structure, or overweight, blood pressure, stress, that is lifestyle. This is like a five fingers. Sugar is like just a small finger, but we are targeting only small finger. We are neglecting lifestyles. That's why it's the disease of what I feel. It is the disease of five fingers. So just giving drug to reduce sugar is equivalent to small finger. It is thumb is the more important. That is lifestyles, weight reduction, stress, diet, discipline. All those things matters. Then anyway, blood pressure, high cholesterol, overweight, then sugar comes. This is how the disease of five fingers, type 2 diabetes. With this, what we do is, we do one the evaluation. As soon as the patient comes, I will evaluate. I will see blood pressure, I will see weight, I will see all examination, I will look at the feet. Like that, I will examine properly. Then I will advise some investigations. Earlier people used to say you do sugars after 30, 40 years. Now we are getting young age also, very young age also. So for the evaluation, I do one blood sugars, preferably fasting blood sugars. If at all, postprandial means 2 hours after food, not 1.5 hour. And we do one thing called HbA1c, that is glycosylated hemoglobin. And that is not sufficient. I do one creatinine to see the how my kidney is working, and I look at the lipid profile, cholesterol, complete group up thing, cholesterol or the lipid profile. Then few other ECG, cardiac, all the heart evaluation like that we'll do. Few investigation. Basic is blood sugar profile, lipid profile, kidney profile. Then if plus ECG and plus or minus other investigations depending on the situation. Then with this, anything blood sugar less than 99, less than 139 after food, normal. Anything more than 126 fasting, more than 200, diabetic range. Then in between, that is called pre-diabetic range. And 99 to 126 fasting, 140 to 199, that is after food. And I do HbA1c. What is that HbA1c? HbA1c, I already told you. We have in blood we have three different type of cells. One is red blood cells, white blood cells, platelets. Red blood cells contains hemoglobin. Hemoglobin function is to supply the oxygen and remove the carbon dioxide from our body through the lungs. So that is a function of hemoglobin, and it stays in the blood for 120 days. That's why that is called stable compound. What is hemoglobin? Hemoglobin is a part of red blood cells to supply oxygen and remove the carbon dioxide. It's a modified protein, pigmented protein. That's why it is red colored protein. It's iron and protein that is called hemoglobin. So after 120 days, it will be degraded in the liver. That's why it stays. When it keep combining with glucose, it forms HbA1c. As the sugar started increase, more and more HbA1c will be formed. It to say 50% of the hemoglobin A1c will be formed previous 1 month, another 25% previous second month, 25% another say third month. That's why it is called 3 months average, because hemoglobin stays in the blood for 120 days. That's why more of the sugar, more of the HbA1c. So hemoglobin it should be normal. If it is less, that is called anemia. But hemoglobin should be normal. But HbA1c should not be high. So it doesn't tell every day's sugar. It tells the average, because sugar will be fluctuating like this. So it tells the average blood sugar, average blood sugar. So it is used for the diagnosis. I don't have diabetes. It should be less than 6, like 5.8. Earlier we used to say less than 6%, and anything more than 6.3, or nowadays, earlier we used to say 6.5, diabetic range. In between, that is pre-diabetic range. So that is used for the diagnosis, and also used for the monitoring. Every 3 months we do, depending on many factors. Say my HbA1c today is 9.5. I come after 3 months, it has become 7.5. It means my average this thing has come down by 2%. It means 2 into 35, 70 milligrams HbA1c has 70 milligrams of glucose is come down compared to that day. That's why it is used for the monitoring. Creatinine is a waste product, or some protein, muscle protein is degraded into the creatinine. The only way to go away from our body is kidney. That is, creatinine goes through kidney and it will be excreted. If kidney is at fault, creatinine will start rising. Why kidney we have to recognize? We have to give so much importance. Yes, we have to give. In our body, two organs are very important. One is liver and a kidney. So they are all cleaning organs, and also they do so many other things also. Kidney is not just cleaning organ. It also produces one hormone to produce hemoglobin, that is erythropoietin, and also it does so many other functions, even activation of vitamin D, or it degrades the insulin, like that, so many other functions in addition to the cleaning or filtering function. That's why kidney will be very important, because so many food waste products or drug waste products or so many potassium excess thing go through the kidney. If kidney is at fault, there are a lot things to be taken care. We cannot use so many drugs. We'll become very selective, and we'll selective on food also. We should not give the food which contains more potassium. Like that, we should. There are a lot of restrictions will come. That's why kidney is very important. Anybody comes, see, first time means I'm detected diabetes the first time. I need not have, problems. I may have other problems also. Kidney might be at fault. That's why even in the initial stages only, in the first presentation only, we will get these investigations in addition to the lipid profile. Lipid profile means cholesterol, total cholesterol, LDL, HDL, triglycerides, all those things. We'll speak on some other type. These are the things. After that, this is the basic and heart function. Simple ECG, or if you expect, or if you think he has got some heart related, echo or TMT will do. After that, with this, we diagnosis and evaluation will come to the management. Management I already told. So the root cause may be some genetics. I don't deny that. Genetics, I think most of the peoples are genetically prone. Our previous generations, they were not getting diabetes because whatever the energy they take used to spend completely. That's why means they were very physically active. We are not anymore physically active. We are only mentally active, means more stressful than stress free. Diabetes, we develop in overweight also, underweight or normal weight also, type 2 diabetes. So here weight may be the main reason. In addition to this, some stress also. In normal weight, stress matters a lot. So what we do is, by looking at that patient, after explaining, patient will come to know, or he or she will come to know why they develop diabetes, type 2 diabetes. Why in young generation? Why in children? By elaborating, they'll come to know, or is it the weight, is it the stress, or something else. Then after that evaluation, what we do is, we'll counsel, like you're an overweight person. So means definitely there is insulin deficiency, there is no doubt. But once you reduce weight, more of the body weight, your insulin requirement is more. If you reduce the weight, your insulin requirement will come down. That's why we can manage with the minimum drugs, or without drugs also for some time. But normal weight fellow, if he develops, probably insulin reserve is less compared to the overweight persons. Oral drugs may not work for longer time. That's why they may require insulin early. But still, if stress is too much, whatever the insulin it is they are having, it is stress hormones are not leaving to work. That's why once stress or lifestyle changes, this insulin will start working. They may require with minimum drugs for many years. So that is, weight is very important. That's why weight reduction and normal weight also. That's what drugs will be working. So by the time we develop diabetes, 50 to 70% of the insulin production capacity is down. Over a period of years, depending on the so many factors, insulin production will start declining by 2 to 5%. That's why oral drugs, the drugs which works to extract our insulin capacity, will stop working. They may require insulin as early as possible, depending on the situations. Insulin is not the last choice. So you can start anytime. I will tell you later. Weight reduction, stress. You see, you'll understand where you are working. How is are you working in night hours? Is it possible to change to day hours? Or you are working in a stressful situations? Can change to very simple jobs? Can you reduce? Can you avoid mobiles unnecessarily? Can you reduce the TV? Or even in families, can you come back to the normalcy from such a stressful situation? Because stress is the one. Once your stress comes down, stress hormones comes down, insulin will work. That's why major this thing is stress management, stress and weight. Rest of the things, one is exercise. Exercise, we think it is for weight reduction. Try means the intake should be less. After that, exercise comes. One chapati, if you take, it will give calories of 80 to 100 kilocalories. One dosa, one or ragi ball, or this much rice, depending on this, it 80 to 100 kilocalories. If I do treadmill for 1 kilometer briskly, I burn only 30 to 35 kilocalories. Means for one chapati, one ragi ball, this much rice, I need to walk for 3 kilometers, more than that. That's why for weight reduction, exercise may not be this thing, but food intake should be less. How this exercise will reduce the sugar means, it with the minimum insulin, it pushes the glucose inside the cells, it increases the muscle activity, so it more glucose will be absorbed into the cell. That's why it will improve the insulin effect. Why yoga is important? It is like a exercise also, it will keep your mind into peace. That's why yoga, exercise, brisk walk, playing, anything, depending on their this thing. And all of a sudden we should not start vigorous exercise, multiple exercise. That is one of the cause for heart related issues. We are accustomed, so slowly improves the or increases the exercise. Not too much exercise, that is not advisable. Not muscle forming exercises and all. Brisk walk. If somebody has got heart related issues, slow walk, cardiologist will advise. Like that, you should brisk walk. Too much exercise is not also. It all decided by your how you are adjusting to that. That's how you are accustomed to that. And you are not very totally inactive. So you slowly build up your exercise. That's why any type walking, if you have a knee arthritis problem, knee arthritis, exercise will be different. So you slowly improve this thing. This is weight reduction. And this, and with this we have so many drugs. Like the drugs, oral drugs work if there is insulin inside, otherwise it doesn't work. So it is like a borewell theory. If water is there, it will pump out the water, otherwise it doesn't work. Like that, there are drugs which improves the insulin effect, or it extract the insulin, or some drugs it slows the glucose absorption. Some drugs it will not allow glucose to absorb in the kidney. Like that, we have different type of things, the oral drugs, tablets. Then we will be starting. Then if drugs are not effective, then we'll start the insulin. Insulin is the one, it's always, earlier we used to start the insulin at the last stages. By the time patient might have developed heart related issue, kidney related issues. So then there is no point in using insulin at last stages. So insulin has to be used as early as possible. So we'll come to know. And we should never go for very strong tablets. Drugs are very important, because see, the drugs, even triple combinations like that, because if you use strong tablets, sugar fluctuation is too much. Low sugar or high sugar, both may be injurious to this thing. That's why we should go for the minimum oral tablets. If sugars are not getting controlled, we may start insulin therapy. In the insulin therapy, there are two types of insulin. One is fast release insulin and slow release insulin. Fast release insulin, it stores the food, and slow insulin, it holds the food. That's why if drugs are not effective, we may add one slow release insulin in the night, so that sugar fasting or early morning sugar will be normal, and we may give some rest to the pancreas, so that drugs will work for the day hours. Like that, we will keep on adding. Then with this, insulin we will use in two situations. One is permanent indication, means if drugs are not effective at all. So, or temporary indications, anybody is admitted in a emergency situation, some infections, severe infection, some major surgeries. Like that, we will be starting temporary insulin, because the drugs will not work in acute situations because of so many issues. That's why we will be using insulin. Then depending on that, you should never think that starting insulin is the last stage. It is the first stage. We should start insulin as early as possible. And there are a lot of drugs are there, injectables are there. If somebody is overweight plus diabetes, some injectables, some oral preparations, that is a different story. With this, whenever we start any tablets or insulin, we should always aware of hypoglycemia, that is low sugar. If somebody takes insulin, even oral tablets also causes low sugars, because somebody taking tablet in the morning before breakfast, they feel very hungry around 11, 12 o'clock. That is also one of the symptom of low sugar. It means it doesn't, you should not, need not take the snacks there. You should check the blood sugar, then you have to reduce the tablet. Or if they delay, they may develop low sugar symptoms. But low sugars manifestations may be more with the insulin because it acts fast. That's why they may develop low sugar. If nerves are intact, so we'll get the information. Our body will become hungry, our heart will become hungry, brain will become hungry, like that, feeling hungry, heart palpitation, feeling heartbeat, then brain tremors, sweating, bad dreams, then severe headache, feeling very hungry. These are all the symptoms of low sugar. That's why we need to take any sugar, simple sugars we have to take. Glucon-D, sugar, chocolate rich in fat. So if you don't get, you take. Otherwise, Glucon-D, sugar, juice with sugar you should take immediately. Then you can modify. The cause is you don't know. You might be taking more insulin than the requirement, or you must be having some heart, kidney related issues or liver related issues. There the insulin is inactivated. That's why sugar symptom, low sugar symptoms may be more. That we have to analyze immediately. What you need to do is feel. You should, some heart patients with these symptoms, they think always heart related issues, they keep on they come with coma. That's why immediately, if you have glucometer, do the sugar, and low sugar less than 70, 80, you take sugars. High sugars doesn't cause acute problems. Low sugars will injure, or permanent injury can occur to the brain. That's why, even if you don't have glucometer, if you feel low sugar symptoms, take sugar. Don't deny that. Then go to the hospital. Low sugar symptoms always, because any heart patients, I have seen the patients, any palpitations, then anxiety, my heart problem has happened. Then they forget the blood sugar. That's why you should. That's why low sugar we should know. And low sugars are less with the newer insulins, that and all we can discuss, and depending on the situations we can. Once sugar, and this is also very important, low sugar symptoms may not be appreciated by many individuals, especially elderly or nerve related. If to send the signals, nerve should be proper. That's why somebody has got nerve related issues, they may not feel the sensation of low sugars, straight away go into the altered sensorium or coma. That's why should be careful. Low sugar is more dangerous than high sugars. If somebody is elderly or aged or heart related issues or some other related, try to keep slightly higher value than the normal values, because we are taking drugs, it will be working, so sugars will started coming down. That's why chances of low sugar will be more. That's why it is not the sugar number is important, it is the stress is the cause for the complications. That's why sugar values try to control. That's why type 2 diabetes is a concept. Once you understand what is type 2 diabetes, what is diabetes, this is not to panic or get stressed. It is the stress matters. You reduce the stress. Even if you are having higher sugars, HbA1c, don't have to panic, but we can manage, we can reduce. Don't give stress. It is the stress and lifestyles making more problems than the sugar alone. But we are giving more importance to sugars. That is also fine, but stress and lifestyles are very important.